Does this sound familiar? Your nose is blocked and it's difficult to breathe. Your sense of smell has been lost. You often have to clear your throat and you feel tired and drained of energy. This does not have to be the case.
These
symptoms are manifestations of a chronic inflammation of the sinuses. There are 4 paranasal sinuses: the maxillary sinuses, the frontal sinuses, the ethmoid sinuses, and the sphendoid sinuses. They're lined by mucosa that, as the name suggests, produce mucus. The mucus is a protective layer that is transported by very fine hair, cilia, into the throat. Inflammation causes an increased production of mucus flowing down the throat. This can lead to discomfort and the constant need to clear one's throat. When excessive mucus production occurs, the small passages connecting the sinuses can get blocked. Mucus cannot leave the sinuses anymore. Oxygen becomes depleted and the pressure in the sinuses drops. This can cause pain. In the vicinity is also the eustachian tube, which is the connection between the nasopharynx, nose and throat area, with the ear. When this region is inflamed, the exit of the eustachian tube is blocked, preventing ventilation and pressure equilibrium of the ear. This can be particularly painful, as often experienced by divers or on an aircraft at takeoff and landing. For these symptoms, the RC-Cornet-N can help.
Wenn wir das Nasenkornett auseinanderziehen,
the RC-Cornet-N consists of a nosepiece connected to a special rubber valve hose in a curved tube. When blowing into the RC-Cornet-N, pressure fluctuations are produced. These vibrations push and pull on the blockages of the sinuses. They cause extension of the small passages and help to transport the mucus. The vibrations also help to restore pressure equilibrium through the eustachian tube. The regular twice-a-day use of the RC-Cornet-N also massages and stimulates the hair, cilia, that transport the protective mucus layer down the throat. The regular stimulus of the sinuses also increases the blood supply to the region, and thus the influx of white blood cells that help to fight the inflammation. Roughly 10 minutes after the stimulation, the swelling of the mucosa reduces, opening the narrow passages and easing the transport of mucus so that blockages can slowly be dissolved. A combination of inhalation therapy and physiotherapy of the nasopharynx is possible with a special adapter that can be attached to the RC-Cornet. The nebulizer and the RC-Cornet are connected to the adapter. One can then breathe in medication from the nebulizer and carry out physiotherapy via the RC-Cornet on breathing out. In summary, the RC-Cornet-N helps people with chronic sinusitis, postnasal-drip syndrome, bronchial hyperreactivity, sinus problems. Cleaning of the RC-Cornet is very easy. The RC-Cornet can be disinfected by shortly boiling it in a pan or on a hob, or it can be placed in a dishwasher. Sterilization in a bath of antiseptic solution is also possible. The RC-Cornet-N helps to liquefy viscous mucus, widens narrow passages, improves mucus transport, stimulates the blood and lymph flow in the nose and throat, reduces swelling of the mucosa, can be combined with inhalation therapy, can be used by people of all ages, reduces mucus production in the nasopharynx. If you have questions or would like to inquire about any of our products, please contact the RC team supported by our medical experts. We're here to help.